Okay, coders, we are moving right along. Now we are going to be working on the endocrine system, endocrine, nutritional, and metabolic disease. So yes, you're still working on your coding guidelines. And I'd like to just ask you, how is the learning going for you? Are you understanding the information? Are you making notes when you do not understand so that you can ask questions in class? I hope you are, because we certainly want to make sure that your foundation is strong. So if you're trying to follow along in the guidelines, this is chapter 4 guidelines. Again, this is endocrine, nutritional, and metabolic disease. So let's get started. So diabetes, mellitus, and the use of insulin, oral hypoglycemics, and injectable non-insulin drugs. So we're not going to get into details about the disease itself because we covered diabetes as a project in medical terminology. So what you could do is review your notes for medical terminology in regards to diabetes. But we also know that to treat diabetes, some diabetics have to take insulin. Also, we know there are oral hypoglycemics. There are pills that people can take that decreases their blood sugar levels. Okay, and also we know there are some injectables that are non-insulin drugs. So more like I call it like a liquid pill, but you inject that into your stomach area. Okay, so you may have heard of Humalog, Novolog. That would be an example of insulin. Oral hypoglycemics could be something like Actos. An injectable non-insulin could be something like Victoza. So those are just examples, but there are lots of different drugs that a person can take for diabetes. Now, we're going to start covering the guidelines. And it says here, if the documentation in a medical record does not indicate the type of diabetes, but does indicate that the patient uses insulin, code E11, type 2 diabetes mellitus should be assigned. So if the medical record does not tell you um, the type of diabetes, but you see the patient takes insulin, you need to code from category E11. Now, this guideline is very important and it's going to follow you for the rest of the section. Now, there are some additional codes. For example, you can code for from category Z79 if the patient has been using insulin on a long-term basis. Also, we'll learn in the next few slides how to code for the oral hypoglycemic drugs and also for non-insulin drugs. But what do you want to take away from this slide? If you see in your medical record, the physician did not tell you the type, whether the patient had type 1 or type 2, but you do see the patient is taking insulin, this is an indication that you should code from category E11. Now, if the patient is treated with both oral medications, okay, so they're taking pills, and insulin, code both Z79.4, long-term current use of insulin, and you can also code Z79.84, long-term current use of oral hypoglycemic drugs. Okay, so again, we see the need to be clear with what type of medications your patients are taking. So is it an oral drug? Is it insulin? If it is, you can code both. Now, if the patient is treated with the oral hypoglycemic drug and an injectable non-insulin antibiotic drug, you're going to code Z7984, the long-term use of the oral hypoglycemic. and also Z79.899, other long-term current drug therapy. Okay. So again, what do you want to take from this slide? That you can code oral hypoglycemic drugs and that you can code non-insulin drugs, right? Now, there is another reminder here that you can see in the bold blue, and it says that code Z79.4 should not be assigned if insulin is given temporarily. So if they're just giving the insulin to the patient while they are in the emergency room, that is not something you would want to code, okay? You would not want to code Z79.4 if they just gave it to them for that evening in the emergency room, because that's not long-term use. Z79.4 is for long-term use of insulin, okay? So we're going to do a quick review so that way you can feel comfortable before I move forward, because diabetes is a very important section. It's a disease that affects lots of people, and you want to be clear on the guidelines. So this is where we started. And again, from this slide, what we took away is that if the record does not tell you the type of diabetes, but you can clearly see the patient is taking insulin, you're going to code from category E11. If you see that your patient is taking an oral medication and they are also taking insulin, what should you do? You can code Z79.4 and Z79.84 to indicate that they're taking insulin and oral pills, and that's not uncommon. And then from our next slide, we saw that if the patient was taking both a pill and a non-insulin injectable drug, that could be coded as well. We could use Z79.84 and Z79.899. And we also learned that we do not code insulin if the person is taking it on a temporary basis. Okay, so what I have here is a medication list that I created for a real coding job that I had, because I had to keep a little list for myself just to help myself. And so I'm going to share that with you. And what you see is the diabetic medications. It may be a little challenging to see, but I'm just going to mention some diabetic medications to help you. You can see Actos here, and then you see Victoza. Victoza is one of the injectables that we discussed earlier in class. Let's see if I can make it another color. So Victoza is like you can give it as an injection, but things like metformin, Rucofage, Januvia, those drugs are oral drugs, and every drug you see may not be listed, but these are just a few. And then there are different types of insulins that patients can take. You have what they call long-term and short-term insulins, or long-acting or short-acting insulins. So here you have Humalog, Novolog. These are Humulin R. You may see Tresiba. These are just some examples. Lantus. So again, you have the oral, you have the injectable, you have the insulin. Okay. So we just want you to be familiar with some of these drugs. And what I can do, if you like, I can email you a copy of this. So once you watch it, if you'd like to see it, just let me know. It has other drugs here that you may find helpful to have a list of. Okay, so let's go back now to our slide. And the next part of this slide is actually going to be a video. So I'd like for you to be patient and watch the video. It's a short video, but the reason why I'm showing it to you is so you can get an idea of what an insulin pump looks like. Now, once we know what the insulin pump looks like and how it's used, I think it'll make more sense for us to try to code it. Okay, so let's watch that video together.
First, wash and dry your hands. Choose a site to insert your sensor. Clean the site with rubbing alcohol and let it dry. Choose a site at least 3 inches away from your insulin pump infusion set or injection site. Avoid bony areas like ribs and hip bones and areas with scarring, tattoos, hair, or irritation. Also, you don't want to use the same sensor site 2 times in a row. Remove both labels. Do not touch the adhesive. Place the applicator on your skin. Fold and break off the safety guard. Press the button to insert the sensor. Remove the applicator. You've successfully inserted your sensor. Now it's time to attach your transmitter. Clean your transmitter with an alcohol wipe and let it dry. Insert the transmitter tab into the slot. Snap transmitter firmly into place. Then rub around the patch 3 times. Once your transmitter is attached, you can swim, bathe, and shower like normal. You have successfully inserted your sensor and attached your transmitter.
Okay, so you didn't actually get to see the pump, but you saw the transmitter that is used to record the diabetic's blood sugars. So this pump, sometimes it does not work properly. Sometimes the actual pump itself fails. So when the pump itself fails, the question is what is done in regards to coding. So a failure could be an underdose when there's an underdose of insulin because the insulin pump failed. So if there is an underdose, notice that we're to code from category T85.6. The title of that category is mechanical complication of other specified internal and external prosthetic devices, implants, and grafts. So this is specifically the pump being referred to here. So the first code would come from category T85.6 if there is an underdose, okay? And the code would be followed by T38.3x6, underdosing of insulin and oral hypoglycemic drugs. And then you would code additional codes for the type of diabetes and any complications due to underdosing. So again, if the pump underdoses the patient, you're coding from T85, T38.6, additional codes for the type of diabetes, complications due to the underdosing. That would be the sequence. Now, what if the patient has an overdose? Well, if there is an overdose, you would also code from T85.6. This time it'd be followed by T38.3x1. All right. So again, you have the sequencing according to the guidelines. So let's do a few practice slides together to wrap things up. When the type of diabetes mellitus is not documented in the medical note, what is used as the default type? Now, these questions I received from the AAPC practice material provided to coding instructors. These are not my questions, and I do not own this property. I just like to say that to give credit where credit is due. You can pause this and think about your answer because I'm going to the next slide. So if the type of diabetes is not documented in the medical record, the default is E11 for type 2. So if they did not document it, you code E11. Practice slide. If a diabetic patient uses insulin and the type of diabetes documented is not documented, if a diabetic patient uses insulin and the type of diabetes is not documented, what type of diabetes would be coded according to ICD-10-CM guidelines? Some patients with type 2 diabetes are unable to control their blood sugar through diet and or medication alone and do require insulin. If the documentation and medical record does not indicate the type of diabetes, but does indicate the patient uses insulin, the diabetes is reported as type 2. So it's still type 2. If you do not have information from the physician that the patient is type 1 or type 2, then the default is type 2. And you would still have to code that they take the insulin. And remember, type 1 diabetics, we do not need to code the insulin on a type 1 diabetic. And the reason why is because they have to take insulin. So there is no need to report it. But we do report insulin when it is a type 2 diabetic. So here's another AAPC practice slide. And this is a question for you to code. A 45-year-old male patient developed an ulcer on his back, his upper back. He has had diabetes for several years and is on insulin. The provider determines that the ulcer is due to his diabetes. What ICD-10-CM codes should be reported? Okay, so before we go to the slide with the answer, we're going to go over a few things together. So let's just talk a little bit before we come up with the answer. This patient has an ulcer on his upper back, but he's also had diabetes for several years. We also see he's on insulin. So quick question. You don't know if he's type 1 or type 2. So you want to remember that the default is E11. And we can see all the codes start with E11, okay? We also see this patient is on insulin. And we learned that for type 2 diabetics, we do code the insulin. The insulin would be coded with Z79.4. We can see that A, B, C doesn't have Z79.4. D does. So because the insulin isn't reported, we cannot use C because it failed to report the insulin. So we have a patient with diabetes, but they also have a problem. We also know the patient is on insulin, and that problem is that they have ulcer on the back. So how would you go about coding this? Well, let's take a look at the coding manual. And what you see I've done is I've actually gone to diabetes in my electronic book. And you can see I've highlighted, where there's type 1, since this is type 2, that is highlighted. Now, we know this patient has an ulcer. And so you may not see anything under ulcer. But if you look here, you will see skin ulcer. And I hope you can find this in your book. You can see skin ulcer. And we're told to look at code E11622. Okay, so you can pause this. That's the great thing about videos. You can pause it and you can go to diabetes. Remember, you're looking for diabetes, but you specifically need type 2, okay? Because we don't know. The doctor did not tell us. So the patient is type 2. I want you to notice that E11.9 simply means they are a type 2 diabetic. But when a diabetic has any of the problems listed below, diabetes with any of these issues, then you have to code it that way, the combination code. So E11.622 is going to tell us this patient is diabetic with a skin ulcer, okay? So while you are finding your information, I'm going to go over to E11.622. And here it is. You can see E11.622, type 2 diabetes mellitus with other skin ulcer. But notice we're told use additional code to identify the site of the ulcer. So the guidelines say we need a code in addition to E11.622, and we can clearly see it's going to be an L code. All right. So now let's go back to that question. You now know that you need E11.622. So we can go back to ruling things out. So I think before we ruled out C, and now you can rule out B because we need to be sure to include the fact that the patient has an ulcer. And you could also rule out A. Do you know why we can rule out A? It mentions the diabetes, it mentions the insulin, but A does not mention the ulcer. Okay, so D gives us the diabetes with the ulcer and the insulin. So hopefully you chose D for the answer. And I'll leave up the AAPC rationale for just a moment for you to see that, but your answer should have been D. Okay, let's try another one. This time we have a patient with type 2 diabetes with diabetic macular edema and proliferative diabetic retinopathy in the right eye. Okay, so what are you going to code for this particular question? Okay, so hopefully you've had a moment to review the slide. Before we move forward, let's talk about some things we know, okay, for sure. We know that this is a type 2 diabetic, and all of our choices are for type 2 diabetic. But this patient has diabetic macular edema and proliferative diabetic retinopathy in the right eye. So the question is, how many codes do you need to report that? So what I need to do And I hate to keep switching you over, but just to make it easy, what I would like to do is actually take you back to the coding manual. Now I'm still under diabetes type 2 because this was a type 2 patient. So you should be under the word diabetes. You should look for the column with type 2. Now you should have no problem finding this because in another video, I had you highlight all the different types of diabetes. So under type 2, we see the word with, and we're going to scroll down till we see our problem, which I've already highlighted. We can see retinopathy here. We see retinopathy with macular edema. We see non-proliferative, but we also see proliferative. Now, there is another indentation here. You can see proliferative with macular edema, all right? So you can see that leads you to E11.351. All right. So what does that mean? Let's go to E11.351. You see E11.351, we can see that it's 6 characters. It has the red 7 beside it. So that means we're going to need an additional character. And it is type 2 diabetes with proliferative diabetic retinopathy with macular edema. And here, right at category, this subcategory E1135, we have a note that one of the following 7 characters is to be assigned to codes in subcategory E11.35 to designate laterality of the disease. So the doctor said it was the right eye. So it should be E11.351. And then we need to add the character 1 for the right eye. So let's see if we're right. Let's go back. Let's take a look at that question. And what do you think the answer is? Just on what we just did. Well, hopefully you have C, okay? And we added the 7th character to identify the right eye. Okay, very good. So next we will do another practice AAPC slide. And this one is a different type of diabetes. This patient is being treated for ketoacidosis and diabetic coma due to malignant neoplasm of the pancreatic body. The patient uses insulin routinely. Well, one thing we know for sure is the physician did not tell us the type. But this diabetes the patient has is not a type 1 or type 2 diabetes. The reason this patient has diabetes is because they have a cancer on the pancreas. Now, if you have cancer on the pancreas, your blood sugars will not be normal because of the cancer being on the pancreas. So what we would call that type of diabetes would be not really type 1 or type 2, but diabetes because they have an underlying problem, an underlying condition. Okay. So this patient is not going to be a type 1 or a type 2. This patient has diabetes because they have a problem that causes the diabetes. Okay. And also, this patient does take insulin routinely. That can also be reported. Pause the video, please. Take a moment to see if you can figure out the answer. And then when you come back, we'll go over some information and determine what the right answer is. Okay, so hopefully you've had a chance to choose your answer. Before I tell you what the answer is, we're going to look together in the book. Now, this said the patient was being treated for ketoacidosis and a diabetic coma due to malignant neoplasm of the pancreatic body. So the body of the pancreas had cancer. So what we'll do now is we'll go back to the coding um, manual, the electronic coding manual, and you should still be under the word diabetes, but this time you want to find where you highlighted due to underlying condition. Now, notice that word with again. So the patient had ketoacidosis, but they also had that with a coma. So our code here leads us to E08.11. Now, what we want to do is find that code in the back of the book. Let's look for E08.11. Okay, so here is E08, but first we'll look at E08.11. Please note that it says diabetes mellitus due to underlying condition with ketoacidosis with coma. Now we are looking for this code, but let's look at the beginning of the section. You can see the category E08. We have guidelines to follow. And when a note is at the beginning of the category, it's for the entire category. So the sequence would be first, we have to code the malignant neoplasm. There are other things that may be coded first, but in our case, the patient has cancer. So first, the cancer should be coded. And we are told it should come from C00 through C96. We also see use additional codes for insulin or oral antibiotics. So the sequence would be first code the cancer, second the E08, and third the insulin. So now that we have an idea of what we need, let's go back to the question. So we now know the answer can't be A or B because the appropriate category is E08. And if you didn't want to look up anything, we could say that D doesn't report that the patient is taking insulin. So what's the answer? The correct answer is C for this particular code. Let's go back. We have the cancer, the diabetes, and the insulin in the sequence we just discussed. So I'm going to take you to the rationale, and I'll leave it here for just a short moment, and that will give you a chance to review the information, the rationale that the AAPC has provided. Okay. So you have done very well with this material. I hope you will pause this video, review your notes, or if there's anything you did not understand, review the video again and or send me an email with your question. We are now going to cover some prefixes and suffixes from the endocrine system, but we'll do that in the next video. I hope you found this helpful. Please remember to meditate. Remember, meditating is the key to helping you learn something new. When you're learning something new, you can't just walk away from it. You have to think about it. So when you see these blank screens, when you see CGS, that's an indication that you need to pause and meditate on these things. So what do you understand truly about the diabetic guidelines? Do you really get it? Have you read them in their entirety before you move to the next section? That might be something to do. All right. It is like 1:30 in the morning, my time, and I'm not going to record anymore because I am so sleepy. I'll have no idea what I'm saying. So I hope you have a good rest of your day. Take care.